all in all, I think it's one of the most impressive peptides that's ever been launched.
I would definitely agree with that.
A high percentage, maybe 80% of people are not eating enough protein.
Yeah. I mean, I went from eating no fat to a ton of fat.
Non-diabetic patients that are on these GLP medications, it's improving cardiovascular, decreasing cardiovascular risk.
Welcome to the Health Shift. So this is a podcast that I think we've all been wanting to do for quite some time now, and this is the first one, so welcome to the first one. If you guys don't know who I am, my name is Dom Iacovone. I'm the founder of Relive Health. I have Dr. Pat Nolan here, who's our chief medical officer, and I have Dom Kuza, who's a fucking genius, literally. Knows everything about peptides, truly. And not being, not really joking at all, one of the most intelligent people I've ever met when it comes to just peptide knowledge and really just overall health knowledge. So kudos to you, man, like truthfully. We have Dom, who actually does a lot of education for us for all of our locations all over the country. If you don't know what Relive Health is, it is a comprehensive concierge medical practice that is all over the country. I think we have about 24 locations open right now. We have 6 opening in Q1, so we'll have 30 locations open by the end of Q1. And they'll most likely be in all major cities across the country in the next 12 to 14 months. So this episode specifically is on peptides and the possibility of what peptides to take with other peptides, and overall kind of just going through it in a much more personal conversation about like what we do, how we do it, why we do it, and really just taking it conversationally. So Dom, I'm going to go right to you.
So one of the things that I really like about peptides is just how usable they are for so many different things. I think peptides fall like in a few categories. We've talked about this, like inflammation, then you have like cognitive, then you have healing, and then you have your fat loss. I think you could like categorize peptides in those 4.
Yeah.
But we can use them in so many different ways for so many different things. And I think that's one of the things that's really cool about peptides. I also think that's why they get so much attention. Like research-wise, clinical trials now are all over, the place in research for just seeing how these things are effective for like Alzheimer's, for example. That's like a huge study right now behind how these things can help with like neurodegenerative disease. Because people are learning, like medicine 3.0 got really popular, like be proactive, not reactive. So a lot of people are starting to pay more attention to this stuff. And, education is out there, but it's not always the best. And hopefully we're here to clear that up, which is kind of the goal.
Yeah, I mean, from us on our side, like obviously in the clinical setting, I would say like from top to bottom, our number one most selling is going to be our GLP-1s right now. But before GLP-1s, I would say like our number one selling peptides were in the BPC TB500 category. Saw a lot of like Sermorelin, Ipamorelin. Tesamorelin is really like, I think ramping up more so now than it used to be. And then, I don't know, man, there's so many now that like and there are still some that really don't have any research, right? That are kind of like floating around. Yeah. And you have to know what to do and what not to do. Like for example, in the GLP-1 category, Pat, I saw your email go out to the clinics, I think it was like a week ago about, what's the new one? Retatrutide, and just how it's like, we're not even really going to go that route yet just because there's like really no research on it. And it's just not worth like the liability of that peptide.
Yeah, definitely coming in the pipeline. I think the interesting thing, I mean, we talk about it a lot. We see it in the clinic. I think like the healthcare literacy has increased, regardless of the age of the client coming in. We get a lot of younger patients coming in, 18, 20 years old, just to come in to get comprehensive labs, just overall wellness. And I think the literacy, like people are more in tune with their health. Yeah. They're more invested into their health, their daily routines, what they can do, to optimize their health and their daily function. And I think that's where the peptides come in and have, accelerated in awareness and popularity just the last 3 or 4 years.
Oh, I couldn't agree more. I would tell you when I first opened Relive in 2017, 2018, I would bet 90% of the people who were coming in were more interested in growth hormone. For like older people with, joint pain, whatever, regenerative issues. And now it's like the total opposite. Like I don't really get a lot of people coming in asking for HGH at all anymore. It's more so peptide related or, BPC 157, TB 500. And part of that obviously is affordability. But at the same time, I'm a big believer that I think if you do, and I think you'd agree, if you do a really good peptide stack collectively, I think it's way more beneficial.
Yeah, I 100% would agree with that. And I was talking to him earlier, like we don't really like we see people using like IGF-1 still a little bit, GH very little, but like Sermorelin, Ipamorelin, CJC, these have gained way more popularity. 100%. Again, it costs, but the effectiveness is still really there.
Yeah, well, like for my personal experience, like I've probably tried all of the peptides we sell, most of them, and maybe even some we don't sell at some point or another. And I'll tell you, when I took growth hormone, and I liked how I felt on growth hormone, like I felt more fluid, I had no joint pain, but also getting those same results from BPC 157. So I really didn't need it. But my issue with growth hormone is I was super insulin sensitive, and I would retain like 20 pounds of water, no matter what. I would just. Doesn't matter if it was 2 IUs, 3 IUs, 4, I would just blow up like a water balloon.
Yeah.
So like, and I know that that's a pretty common side effect of growth hormone. Obviously not as like, as drastic as mine was, but definitely it's in there.
So like I can't take growth hormone.
Yeah.
Every time I do, I get super insulin resistant. My
Same
A1C
thing.
goes
Same
up
thing.
like
Yeah.
0.5 points. It's bad.
Yeah.
I even see with, like male patients, regardless of age, some people get some mild fluid retention. People complain of like wrist pain, numbness in the hands, things that.
Yeah.
And even at lower IU dosing,
For sure.
I mean, that's something I think, we can speak at least the last probably 5 to 7 years that I've been involved with the peptides, the side effect profile's pretty minimal.
Yeah,
I mean, it's
super
minimal. People have had really substantial results in day-to-day function. Some take a little bit of time to get the activity and that sort of thing, but the side effect profile is great. Haven't really had any issues or any major issues at all that I've seen.
So going through semaglutide, tirzepatide, and retatrutide, like which one of those, is it patient specific, or do you feel like there is a premium product in those three and you would lean towards one more than the other?
I would say like the last 3 to 4 years, we've used a lot of the semaglutide.
Mm-hmm.
I would say some younger people would get common side effects like nausea, some acid reflux, headache, some small things like that. Some people at lower doses or starting doses would get it and they kind of work their way out of it as they progress through the dosing protocol. The tirzepatide, I think across the board, less side effect overall, having that GLP functionality and the GIP functionality. I think the weight loss is a little bit more progressive for people that maybe have more weight to lose. I think the efficacy overall is pretty great for both. I think the retatrutide, I think once clinical trials get through and there's more information, more studies, I think there's a lot of potential.
Yeah. So I'm going to give you my personal experience actually, and I want you guys to like dissect it, right? So I started, I think probably like 2 years ago when these came out, I just started trying the semaglutide. And I did it exactly how I was supposed to. And the first thing, and I can't take semaglutide like at all. First side effect I got was like severe kidney pain. Like my kidneys were throbbing when I woke up in the morning. Like, and it was not on a big dose. It was on like a maintenance dose. I wasn't trying to lose weight. I was just trying to see like what it would do. And I actually thought like something was wrong with me, and I didn't correlate the two because at the time I didn't really know there was a side effect of kidney issues with that, and there is, correct?
Yeah.
So that was my first issue, and then my second issue was I would give myself a shot on, it was like Mondays. I would give it to myself every Monday, and I literally would be projectile vomiting on Tuesday, not on Monday, on Tuesday. So like I never correlated that it was the semaglutide because it happened the next day. So I literally thought I got food poisoning. So the first time I took it on a Monday, no issues. Tuesday morning, woke up, was so nauseous that I literally couldn't get up. I had one of the nurses from Relive come to my house and give me an IV because I thought I had food poisoning, literally like puking and like just diarrhea. That's like the whole day. That's all I had. So I was like, fuck, man. And then the following week, because I obviously thought I had food poisoning, took it on a Monday, went to the airport to go to Nashville on Tuesday, and literally hit me on the plane. And I was like, this is insane. And I didn't put 2 and 2 together. But then I was like, there's no way I got food poisoning
like
twice, exactly a week apart. And then I started looking into it, and then I realized, okay, like there's a problem here, right?
Yeah.
And so yeah, I'm not able to take semaglutide at all. And now I take the maintenance dose of tirzepatide just because I think really the growth hormone kind of fucked up my insulin sensitivity. And I like it. The tirzepatide, I do a very low dose weekly. I feel great. I'm someone who comes from like the bodybuilding world. So like for me, I just always thought you had to eat a lot of food, and my body's just very used to eating a lot of food. So the ability for me to now use that to not eat, but to eat normal has helped me tremendously.
Yeah.
So now, when I sit down, I don't feel like I need to have 10 ounces of chicken or 10 ounces of steak and potatoes and that. Like I can sit down and have a normal meal from a restaurant and not get extra protein anymore. And I feel great. I look great. I'm healthy. So that's like the reason why I use it. And obviously to, keep my insulin, my glucose levels down too. When I would wake up in the morning, I would say probably like a year ago, my glucose meter would read like 102. Now it's in like the high 60s, low 70s. So obviously working, and maybe it's obviously because I lost weight, all the other things that come to, I'm much more active. But I love them for those reasons.
Yeah. I've tried all three.
I did try the Retta. I didn't notice anything.
Yeah, I've tried all three. I didn't really notice anything from Retta.
Yep.
Tirzepatide I liked. Semaglutide I got like nausea really bad on semaglutide. That didn't happen when I took tirzepatide.
Me neither.
But I lean more towards like suggesting the tirzepatide when I suggest it to people. But just because like the side effect profile with semaglutide, I feel like is a little bit more frequent.
Agreed. And I feel like for a female, like those are pretty serious side effects.
Yeah.
Like diarrhea, puking, kidney function. Like, you know, when you're trying to lose weight, they'll pretty much do anything to lose weight. But at the same time, like I have seen no issues with any really of our patients on tirzepatide.
Yeah, I think the side effect profile is a lot less.
It's more expensive.
Yeah, the patients that I saw in clinic too, it seemed like younger patients for the most part would get hit with like the nausea, headache.
Well, also younger people, just from like knowing, right? Like they take more.
Yeah.
You know, you tell them to take X and titrate up to this dose the following week, they're going straight to that fucking other dose, right? Like they don't listen. And that is, I do believe that if you do titrate properly with semaglutide, like I think I just took too much to start. I don't remember who gave me the protocol, but it was just too much because like it got better, but my kidneys kept hurting. So that's why I ultimately came off of it. Like the nausea went away. And the diarrhea, but like the kidney pain for me was it. You know, my dad has a history of kidney issues, so I was like, yeah, no way, I'm not doing this.
Yeah, I remember about your kidneys hurting.
Yeah.
Matt had texted me, and he was telling me like, what could this be from?
Oh yeah, it was wild, man. Like it was like
you were on vacation one time.
I was on vacation,
and it hurt, and it happened really, it like flared up really bad. Yeah,
like I thought I like pulled my back because it's such a dull ache. You know, like it's like a strained muscle, maybe like in your erectors or something. And then it just wasn't going away. And I was like, I'm not doing anything. So there's no fucking way that's from this. But my markers were fine.
Yeah.
You know, I pull my blood, totally fine.
It was
just like an achy pain. So again, drank a ton of water and nothing else fixed it. So I was like, you know what? I'm done. I'm not taking this anymore.
Yeah. One of the things that I like with some like the GLP-1s is I suggest a lot of the time 5-amino 1-MQ. It's an oral capsule.
Is that what Sammy takes?
Yeah. Yep.
Yeah. My wife, she loves that.
Yeah,
she said she notices
it's really big,
difference.
like in obesity research. It's also really useful for like keeping NAD levels higher because it inhibits an enzyme that breaks down NAD. I've noticed a lot of benefits. I take it before training.
So would you take that with NAD, or would you take it?
So like you could take it with NAD, and then it'll just keep your NAD levels a little bit more elevated because we do process NAD really quickly.
For sure, yeah.
Like after an injection, like it'll be up for like a day or two, but like because you're metabolizing it all day long.
Yeah.
The idea is that you're taking the 5-amino to kind of keep those levels a little bit higher.
Yeah.
So that you're not breaking down a ton of it.
Yeah, it helps with. We've started to use that in the clinic more over the last year and a half.
Yeah.
And a lot of the clinics have done well with people on the GLP medications and the 5-amino, just helping with like the mechanism of fat metabolism. And people have had, even people that maybe plateau a little bit on the GLP medications at like an intermediate or a high dose, adding in that 5-amino, typically 50, 100 milligrams?
50, 100 milligrams a day.
Kind of getting people through a plateau.
I find it absolutely fascinating that there's a whole industry built on GLP-1s now. So like on the supplement side, right? I was just at a Hy-Vee launch, our launch in Hy-Vee, and where the hell was that? I forget, some cold place up north, Michigan or something up there. And it wasn't Michigan, it was another state. But we were up there at their corporate headquarters, and what they did is they set up a whole fake store in a convention center. And in the convention center, they're showing like their new resets for 2025. And they have an entire section, top to bottom, probably 10 feet wide, for all supplements for people on GLP-1s. So the top, like, you know, where it's like weight loss, you know, whatever, protein, GLP-1 is what it says on the sign. And everything underneath it is like, you know, meal replacement, like different types of like vitamin and nutrient, like, you know, obviously like vitamins and stuff. Grunes, that company is, you know, 7 to probably 9-figure company already because they make a gummy that basically replaces all the things that you don't get because you're eating less. And it's just everything is geared towards this new market. It's absolutely insane. That just shows you how many people are taking these.
Yeah. It's everywhere.
The crazy thing is, too, I think looking at the national obesity statistics, like in the United States, like I think they claimed maybe in 2023 or 24 that there was a drop.
They went down.
Total number.
For first time ever.
Yeah.
Yeah. And like it had been steady from what I saw for years.
Yeah.
I mean, the obesity numbers are pretty high.
I would argue that the introduction of GLP-1s, although there are side effects of GLP-1s, that what they're going to do for the overall health of the country is going to put us in a much better place due to weight loss, decreased obesity, increased heart health. I mean, now they're doing all the different studies. What is it, Parkinson's on the GLP-1s?
Parkinson's, Alzheimer's.
You know, there's so many things that I think you're going to see come positive from this that are impressive. And
Dom and I were just talking about, I think there were some studies in 23 released about like major adverse cardiovascular events and the decreased risk, like people being on GLP medications. Obviously, they are intended for type 2 diabetic patients, which over the time are going to have a higher cardiovascular risk. But even looking at all the people now that are non-diabetic patients, like any one of us, non-diabetic patients that are on these GLP medications, it's improving decreasing cardiovascular risk.
Yeah, no, it's absolutely insane.
Yeah, no, and like another thing with them too is with there's research right now for compulsion disorders on it. I don't know if you ever noticed this, but like, did you ever notice that like when you would be on these, like you didn't have like cravings or compulsions, even to do behaviors? That's being researched right now to like help people like quit smoking. You could take GLP-1 maybe.
Really?
To help with just killing the craving. Like I smoke cigars regularly, and when I'd be on like a higher dose, I wouldn't like crave the cigar anymore. It was really weird. But then I started digging into like research, and there's some research right now with like autistic population and helping with their compulsive behaviors while on it.
The stuff that I've seen in the clinic too, that probably the two most common things that people tell me every day are like decreased cravings for like sweets or like junk food, which makes sense. And then some people with alcohol and wine, like people that would have like a couple glasses of wine.
I couldn't drink on it. It made me sick when I drank.
Some people
I forgot about that.
Routine wise, like I do 2 or 3 glasses of wine at night, and as soon as they get on it, it's totally kicked.
Yeah, like, I didn't like not have a craving, but I don't really drink anyway, so I don't think that's probably why. But when I did drink, like if we would go to dinner, holy shit, man, I would be destroyed the next day. Destroyed, hungover as fuck, like couldn't do anything.
No way.
Yeah, absolutely. I forgot about that. So now I guess going into the next issue, right, of this is I'm going to take this podcast for GLP-1s just because I think it's probably the most popular one, and then we'll literally just keep going with other ones. But like, I think I would bet 99% of people are interested in this topic. So I think if we ran with it a little bit longer, it would be good. But I think one of the one negative side effects of GLP-1 is the lack of nutrient while on, right? So like, when I'm hungry, I'm not craving steak anymore while I'm on a GLP-1. I'm craving like something that I just want to eat because you get full so fast, right?
Yeah.
So you're starting to see patients, at least with us, they're losing weight, but their diet is definitely becoming a little bit non-nutrition based, I guess is the nicest way to put it, right? Instead of grabbing, chicken and rice or chicken and vegetables, they're going after a burger because, they only eat half of the burger now, so it's not a big deal. And what's your recommendation there?
And I recommend a lot of our supplements that Revive for that, but
even like diet wise, right? Like, so if you're going to put someone on a GLP-1, I think it's important to say, hey, look, like this is going to happen. You're going to obviously lose it. Not to someone like ourselves who really understands food, understands nutrition, knows we have to do a protein forward diet. It's probably implementing a couple shakes a day just to be able to make sure you're hitting a quality protein intake for the day. But like, what are you saying to a patient that comes in that's starting this, that's maybe morbidly obese or maybe, 80 or 90 pounds overweight? Like, hey, make sure we're still getting this many grams of protein in a day. Like, how are we going through that piece of it?
I think it's super important. So I do a lot of consults at the clinics. When I sit down with people, I try and gauge where they're coming from, diet and exercise wise, even sleep. So if they're not well versed diet and exercise, I always tell people, pick 2 or 3 exercises that you're comfortable doing. If it's walking, pickleball, like anything. Cycling.
Yeah.
A lot of people we got to just kind of give a nudge to and see if they can start walking, and everybody's in a different spot, if it's arthritis or other issues going on, but just encouraging people to walk 10, 15, 20 minutes a day, track their exercise, and then we can adjust as time goes on. Diet wise, I always encourage people to use like a calorie tracking app, track their calories, and I always tell them you don't have to weigh your food out, but measure so you know about where you should be at calorie wise, so you're not too low and you're not too high. I've seen people not respond well to the GLP meds that have been in a caloric deficit for a long time, like months and months at a time. The second part too, I have people track their total protein, because a lot of middle-aged adults, people get busy, schedule's crazy. A lot of people think they're getting enough protein in, and they're not anywhere close. You know, they're probably eating 40 or 50 grams of protein a day when they need 125, 150. And that makes a big difference energy-wise, how you feel, maintaining skeletal muscle, you know, activity, exercise, things that you can do. So I think a lot of people are short on protein. I tell people, like, food groups, you know, you don't have to make drastic changes. If you're drinking 6 cans of soda a day, try cutting back to 2 or 3. Doesn't mean you have to completely cut it out, but try and get, you know, quality protein sources. It's different for everybody, but, you know, pick the stuff that you can tolerate. Some people lean more towards beef. Some people can do salmon. Some people can do Greek yogurt. Fats, I always talk to people about fats as well. I personally have had, I think, good benefit from stuff like almond oil, macadamia nut oil, avocado oil, specific oils, and like getting my fat source from either like a high quality peanut butter, almond butter, you know, high quality oils. I use a lot of almond and even extra virgin.
You can
almond.
do a whole podcast on just the nutritional changes of 2024 and 2025. But I mean, I went from eating no fat to a ton of fat and really not as much carbs. And I've run a ton, you know, and I'm still able to maintain all of that on really just carbs while I run. And then the rest of the day, I'm really just a high fat, like, and quality fat, you know, I'll eat a ton of it.
I think if people get into that routine, like, it takes a few weeks. Once they get into that routine, like, they see, you know, they start losing weight. They see how much better they feel.
Well, that's where I was going to get to. Like, there's a huge psychological aspect to GLP-1s too, because, like, let's just be honest. Someone who's overweight, they're coming into the office, they're trying to lose weight, right? The hardest part is the initial is losing the first 5 or 6 pounds, right? And when it comes to someone who isn't working out, who's not eating right, you put them on a GLP-1, they're going to lose weight no matter what, most of the time. But if you can get them to say, okay, hey, instead of just changing your diet, doing this, doing that, let's just walk 10 minutes a day and start. And then once they start to see the weight come off, they'll do anything. Yeah. They'll do anything they need to do because they've tried for so long. And granted, like, try, right? They've tried. But now that it's actually happening, they're bought in because it's working. And then once they get that little taste, they're willing to drop the garbage food, increase their protein. And I do agree with you when it comes to, like, how to, like, for layman's terms, an easy way to get the average person to eat more protein on or track calories on a GLP-1 based diet is really to track their protein. Because if you're getting 100 grams of protein in a day on a GLP-1, you're probably full. So it's really not much left to fill with carbs and fat, right? Yep. So I think for the average person, it's super easy to do. But I do agree, though, like, that mental piece of that first month of that 15 pounds that comes off, like, I've never seen more people get so excited that have never had anything like that happen to them. And then that's what gets the bite. And then it's all of it, right? Then it's the diet, the GLP-1, the exercise, because they see something working and they want to beat it the next month and the next month. Those are the best patients.
Yeah. I always think, like, initial buy-in is the most important. So 100%. It's like immediate result. If you can get that to happen, there's just like a snowball effect.
I mean, we've even used GLP-1s, for example, like when we start people on hormone replacement therapy for women who are a little bit out of shape, that really the main thing that they need is hormones, right? Like, you look at their blood work, you see they're deficient all in that area, but they also want that instant gratification of losing weight because most women associate hormone replacement therapy with either excessive weight gain or really low sex drive, right? Those are the two things that really play into it. And adding a GLP-1 in when someone starts hormone replacement therapy, if they are a little bit overweight, you're getting both quick, right? You're getting your sex drive pretty much within 2 weeks, right? Yeah. Immediately. And then you're getting the weight loss within the first week. So now it's like, great, you know, you're fast tracking their results. And then once their hormones are really progressive and they're back to where they should be, you can pull that GLP-1 out. And now they're just on this constant state of hormone replacement therapy, which is great for them. I think that's one of the greatest assets for HRT too, because most people come in for that, men and women, when they realize, okay, my gut's getting a little big, you know, like, I'm not hitting the gym as much, and it has nothing to do with really anything besides the fact that their hormones are low. They have lack of motivation, lack of energy, but once you fix that, they'll be fine. But bridging that gap for a month or two of a GLP-1 is awesome because they get rid of the weight, they feel great, back on track. Now they feel like they're 20 again.
Yeah. No, that's a great point. I recommend a lot too, like, just low volume food. Yeah. So, like, oils are great. Like, just making your meals smaller. I've even told people, like,
calorie dense.
Yeah, almost. I've even told people, like, set timers on your phone. Yeah. Just to remind you. Yep.
Because you will go all day without eating.
And that would happen to me.
Me too.
Yeah.
All the time. I would literally wake up, like this morning, I'm not even on them anymore, but I'm just so used to it. Like this morning I wake up, I trained, I did an hour, burned 1,000 calories, boom, gone. I didn't even eat yet. And I just realized when you said that, I haven't eaten yet.
Yeah. So that's a big thing that I do tell people to just be mindful about. If you have to like set a timer.
Because you do feel
alarm,
like shit.
You do.
If you don't eat, like even though like you
You're
don't need to, like you'll notice like at the end of the day, either you'll binge eat something because you can justify it in your head, oh, I haven't had any calories all day, or you just are like almost in this like lethargic state.
Yeah. No, I usually tell people too, like if you have to use like daily greens, I push a lot with it, just because if you're gonna because their appetite's so suppressed, vegetables are like the last thing they're thinking about eating. Fruits and veggies are the last things they're thinking about eating. So I always recommend like daily greens with it, just to have at least once or twice a day, to just replace like this water bottle. Just put it in here, drink it with, if you don't even have to be eating, just drink it.
Yep.
And then essential amino acids I use a lot.
For sure. Absolutely.
Because research wise, we know that you don't need all of them to actually have muscle protein synthesis. You just need enough leucine and then the rest of the essentials. So I'd give people like a couple scoops just throughout the day, just to make sure that they're getting that.
And to be fair, leucine tastes terrible by itself. So mixing it in,
EAAs tastes pretty gross, but
but leucine by itself is even worse.
Yeah.
So EAAs are much better than leucine.
I think daily greens, the essential aminos. We put a lot of people on Complete Vital.
Yeah,
that works great.
Sure.
That has red yeast rice extract, N-acetylcysteine, nattokinase. We use a lot of that. D3K2 is huge. I mean, I think we sell more D3K2 than anything.
We should all be taking all of those, right?
Yeah.
But it's definitely. I
tell people from an energy standpoint too, like going back to like supplements and peptides, things that we can incorporate with the GLP. Like daily greens is helpful. The D3K2, as far as like a mild boost of energy.
Sure.
I mean, people feel better when they're taking the D3K2. Yeah. We got some people that take magnesium glycinate alongside of it, but
I'm a big believer in magnesium glycinate for sure.
Yeah, well, so like how much you train, how much I train.
Yeah,
people don't realize how fast you deplete magnesium through the day.
Correct.
And like just training turnover, metabolic rate, all that, you're just pumping through magnesium.
Yep.
So like I recommend magnesium to everybody.
Yep.
And then people who train, I even recommend even more.
You know who brought that up to me? I was talking to is Natasha.
Yeah.
You added it to her.
It's in her plan now.
Yeah, and she was like, I've never felt different from a vitamin in my life than
now she
when
does.
I added that. And she's like, I feel I don't need like coffee. I'm just good for the whole day.
Yeah, because we just
most people
deplete
won't correlate that though. It's very,
everyone thinks like magnesium is good for
sleep, stress.
Yeah.
Totally different.
Cofactor for muscle function.
Yeah.
It's like 300 enzymes reactions it helps with.
I know, it's crazy.
Yeah. Oh, the other one, I know we were talking about 5-amino. We've had people use tesofensine.
Yeah, tesofensine is a pretty cool one alongside the GLP-1s too.
Hits more like dopamine, serotonin. From people that we've had on in the clinic, 250 or 500 milligram, like once a day. It seems to help a lot with appetite, like the appetite control. So people, again, like if people have been on the GLP meds, if they hit a little bit of a plateau.
You add that in?
Add it in.
And then do you pull it?
We can. Sometimes after 30, we'll use it for 30, 60, 90 days.
Yeah.
And sometimes it's been pretty beneficial overall in getting people through like a plateau.
Yeah.
That's
it
awesome.
helps with like your neurotransmitters and then the influence they have on appetite. So like, because sometimes like some people will be on GLP-1s and then the appetite comes back like full force.
No shit.
Even while on it still.
Okay.
So then sometimes like tesofensine can come into play just to help with that appetite.
Now explain like the mechanism of a GLP-1, because I'm sure like we understand that, right? But like most people think you take it, it just makes you not hungry. But there's so much more to a GLP-1 than that.
Yeah, we know from obviously the hunger signaling in your brain goes down.
Yep.
We see a slowing of gastric emptying.
Yep.
That's why some people get like reflux from it.
Or
some people get
constipation.
constipation from it. But then we see, stimulation of glucose uptake in tissue. We see stimulation of fat, fat lipolysis and like fat tissue.
Yep.
So it has a lot. GLP-1 receptors are all over your body.
Yeah, we were just talking about it this morning. They find, there's a lot of different locations: blood vessels, cardiomyocytes, receptors in the brain, receptors in the intestinal tract, things like that. So it has kind of a larger scale effect, which I think part of the stuff that you're seeing in research, like beneficial cardiovascular effects, possible beneficial, neurocognitive effects, decrease overall inflammation.
Yeah.
I got crazy stories from the clinic. We have a few psoriasis patients
I've heard of that
have had
gone.
so like
The outbreaks
autoimmune
are
disorders.
gone.
We see autoimmune, the prevalence is a little bit higher, but we literally have 3 or 4 psoriasis patients. Once they got onto tirzepatide for like 6 to 8 weeks, swear to God, these people came in and said, I've never felt better. I don't have pain. My skin is better than it's ever been. I mean, the overall anti-inflammatory effect and the effect that it has on the glucagon like peptide receptors.
Well, that's where
There's
research
more
is
to it.
going now.
Yeah, more to
Like-
it.
Well, it's like anything, right? It's like it starts in one bucket,
Yeah.
and then you realize how many other things it can do, and who knows what they're going to figure out. But the beautiful part is really side effect wise, it's very minimal on all of them, right? So I think I'm excited to see the next 5 to 10 years and see what they actually figure out, what these things are really doing. But all in all, I think it's one of the most impressive peptides that's ever been launched.
Yeah, no, I would definitely agree with that. I think another thing that we use it a lot for too is, like I've been in the bodybuilding world for a long time, and even like in reverse dieting situations, like people who didn't need it to lose the weight, but afterwards we can use sometimes.
I never even thought about that.
Small
it's a great
doses
idea.
to just control any binge like behaviors after,
or just
like,
getting used to eating more food again. You know, like the body itself, like I can only imagine you're depleting yourself of carbs, I would assume, for quite some time, and then peak week of a bodybuilder, now you're increasing carbohydrate uptake drastically, and then after you most people do not follow a reverse diet properly, so that huge glucose upswing is probably dumping into your blood, and the ability of a GLP-1 in that process probably helps a lot.
Well, like there's also like a lot of people who training in general can cause a lot of stress-induced insulin resistance. Like your stress response actually could cause insulin resistance. It doesn't have to be like you're overeating carbs, or it could be just sleep deprivation and a lot of stress. And if you're training a lot, your stress load's really high. We get people all the time that like have like high A1Cs, and you're like, how? You're dieting, you're training a ton. A GLP-1 is a really good tool. I took it mainly because I had such bad insulin resistance, and it fixed it like in 3 months. I went from like a 6.0 A1C, like pretty much
And
diabetic.
what do you
And you have no body
what do
fat.
you correlate that to?
I think it was
yourself.
bad sleep. It got really bad when we had our first kid. That's like when like sleep deprivation was obviously huge, and then my A1C I just started putting on like ton of visceral fat, just like my stomach just kept like protruding out, but like nothing else got fatter. It was really, really odd. And then my A1C, I got it checked. It was like a 6.2.
Wow.
And that's diabetic on paper.
Yeah.
So I was like, I got to do something. Like, I don't want to take insulin and just kind of put a Band-Aid on it. I want to fix the problem.
My father-in-law is fully fixed. He's a diabetic, and all he takes now is semaglutide, and he's totally fine now.
Yeah, so it fixed me completely up. And I didn't lose any muscle tissue. I didn't lose.
But you're not normal.
I'm not normal.
Yeah,
but
as far as even education, right? Like you knew what to do. Most people jumping on this are absolutely going to lose muscle tissue.
yeah, but that's that's our
job
to
100%.
make
which
sure
is why
you're
I was
doing it right.
it was very important to bring up the diet and really protein tracking.
Oh, I 1,000% agree with that. And like
I've seen people start semaglutide, and let me tell you, they look better fat.
Yeah,
I
they
hate
look
to say
scary.
it.
They look
I hate
malnourished.
they look like skeletons,
Yeah.
like walking skeletons. And it's like, okay, that's great, but like you don't look good. You
Yeah.
look like you need to eat anything at this point.
Like
I think
my master's research was all on amino acids and muscle protein synthesis, and sarcopenia is like just the natural aging loss of muscle. One of the biggest reasons we see that happen is because as you just get older, you eat less and less protein.
For sure.
Yeah.
So that's why, like with older
You get
people,
comfortable,
we
you're
have to make
married,
sure
you
that
don't give a shit. Yeah, I get it.
I think really the average person probably doesn't really understand like the macro breakdown.
Yes.
And I would say a high percentage, maybe 80% of people are not eating enough protein.
Yeah.
Probably not enough hydration either. But like
Yeah.
I always talk to people about, like adequate hydration and a few things with that, but really tracking protein to make sure you're getting enough. It tends to makes a big difference.
Couldn't agree more. Yeah, I mean, I think this is like an ideal, perfect podcast. I think that we've done a great job of explaining like GLP-1 and how it works. And also just putting it in layman's terms, right? Like the average person asking the questions, understanding what to do, what not to do, how to pay attention to certain things, side effects. And I think the goal would be to continue to do these on all the different peptides. And really, again, I think on the next one, we can really go into what we take together. I think TB500 and BPC would be a great podcast. But education is really important. And I've actually noticed that I have these old videos that I made like 7 years ago on YouTube that I don't even know what YouTube they're on. I can't even delete them, but they have like 100,000 views because there's still such a lack of education for a lot of this. And if it is educational, it's like to the point where people are just like, what the fuck are you talking about?
It's too.
I have no clue, right?
Yeah, people want the basic. They want
what
the
to
basic
do, what
knowledge.
not to do, how to get results, and how not to fucking kill yourself, basically. And that's, you know, ideally kind of where I want to fit in the middle. And really, like, you guys can take it the clinical way, Pat, Dom, and then I can just kind of break it down into like, hey, like, I'm an average person. I want to understand how this works, what to do, what not to do. Obviously, I know a little bit more than the average person, but you guys are obviously much more educated than I am. So I appreciate you guys jumping on the podcast, and let's do the next one soon.
Yep. Thank you.
Sweet.
Perfect.
Thank you for watching. This podcast is intended for general informational purposes only and does not constitute the practice of medicine, nursing, or any other professional healthcare services, including the provision of medical advice. Listening to this podcast does not establish doctor-patient relationship. Any use of the information provided on this podcast or materials linked from it is entirely at the user's own risk. The content of this podcast is not a substitute for professional medical advice, diagnosis, or treatment. Users should never disregard or delay seeking medical advice for any health concern they may have and are encouraged to consult with their healthcare professional for guidance and care.